Gosh, I feel like I'm in church now. Welcome. Good morning. All right, that's good. My name is Michael Scott. I'm with the Colorado Hospital Association, and I welcome you to Sports Authority, home of the Denver Broncos, champion Denver Broncos. All right, and this is also home to CHA's Fall Career Event. This is our 5th year holding. We hold 2 events a year in March and in October here at Sports Authority for job seekers. So that's a little public service announcement. But basically, I am here to introduce our keynote speaker, Konnie Martin. She's the CEO of San Luis Valley Health in Alamosa. She has an extensive background in healthcare. Before becoming the CEO in 2013, Konnie was the Chief Operating Officer for several years at San Luis Valley Health. Prior to joining San Luis Valley Health, though, Konnie worked in leadership at a community health center for a number of years, for over 20 years. So Connie's an innovative leader that is skilled in leveraging community stakeholders in healthcare conversations. In 2015, Konnie was asked to present to the American Hospital Association about bringing communities together and what that means, because there's so many different people involved in a community to deliver health care. Sort of like we've heard the term, it takes a village. Well, it takes a community when involved with health care. In 2017, which is very, very dear to many of the members in the Colorado Hospital Association, Konnie represented healthcare leaders and rural healthcare leaders several times by testifying with the state legislator in support of the sustainability of rural Colorado bill, where hospital provider fee was redesignated as an enterprise fee. I've had to testify before Senate, and testifying before Senate is just really something. It's intimidating a bit, but Konnie did a wonderful job in doing that, and also was very key in that key bill being passed. And if it hadn't been passed, several of our hospitals potentially would have been in jeopardy of closing. So that was really, really something that was special. She serves on our Colorado Hospital Association board and our Colorado PAC committee, which is our political action committee to help with those legislative activities. She has many community involvements, such as being the Adams State University Presidential Search Committee liaison, and serves on the board of the Alamosa County Economic Development Corporation, and was appointed by the governor to the STEMI task force. She has attained advanced leadership training at the Regional Institute for Health and in environmental leadership at the University of Colorado Health and Sciences and the Center for Disease Control. She's completed healthcare executive program at the Johnson & Johnson UCLA executive program, and she's earned the American Hospital Association Healthcare System Transformation Fellowship. And she graduated from the University of Arkansas, Monticello, down south. What her bio doesn't say, don't worry, Konnie, don't worry, Konnie, is that even though she's lived in Colorado for over 30 years, she's not completely lost her Arkansas accent. She still retains her Southern charm and spirit, and when she first moved to Alamosa with her husband, who took a position with the local university, Adams State College, she didn't know then that she would be working professionally in healthcare for the rest of her career. She applied for several open positions and started with entry-level positions, something many of you job seekers are here for today. Could be applying for an entry-level position and turn out to have a career, something like what Konnie's had. Konnie's leadership abilities that propelled her to the healthcare industry gives her a wealth of knowledge of how healthcare can be provided efficiently, effectively, with the utmost competency and compassion. Konnie hasn't looked back, as she and her husband have contributed to the success and health care delivered in Alamosa residents, either by her administrative and leadership abilities or by her husband's coaching and training world-class runners at Adams State College. And for those that you really do not know, that's where some really world-class runners come from all over out of Adams State College. It's really pretty neat. She is empowered frontline, and her leadership style embraces teamwork, transparency, and trust. Connie's relentless passion to improve healthcare and provide specialty services to a rural community have improved the lives of many seeking top quality healthcare in the San Luis Valley. So with that, let's give Konnie a warm welcome as she speaks to us.
Thank you to Michael, Kelly, and the team from CHA for having me. I appreciate that. I think you can probably tell in even just my first few words that the comments about my Arkansas accent are really true. Though my family there thinks that I sound very Yankee to them, so it has changed a bit. It's a pleasure to be here today, and what a fun experience to be here at Mile High Stadium. I don't know about all of you who live in Denver, but for those of us in Alamosa, we don't get to come have meetings at Mile High Stadium very often. I told my son, who is an avid Bronco fan, that I was speaking here today, and he's like, well, how many people are going to be there? And I'm like, well, how many does it hold? And he said 76,000, and I said, well, there's just a few less than that. So I appreciate you being here today and participating in this career fair, and I'll appreciate it if you won't tell him that we're slightly less than 76,000. As Michael shared with you, I am the CEO of San Luis Valley Health. We're a small healthcare system located in the San Luis Valley, which is in south central Colorado. Our service area covers 6 counties. We're nearly the size of New Hampshire. Our healthcare system is comprised of 2 hospitals and 5 clinics. We provide 80% of the healthcare that happens to our 50,000 residents in our community. Our 650 employees make us the largest employer in the region. I'm here today to welcome and celebrate your participation in this event. Searching for employment in the healthcare sector can be an exciting experience. Our world is large. In the United States alone, we encompass 17% of the gross domestic product, and we're expected to continue to grow. The types of jobs and careers paths we have are varied, and I truly believe that there's something for almost anyone. Healthcare is under incredible pressure at the national and state level. The tension between our desire for covered services and rising costs is fueling a debate that will likely not stop soon. The opinions about the role of government in our healthcare system are as varied as the leaders who are trying to guide our future. However, there is no debate that in healthcare, we are seeking top quality, affordable care delivered with the highest level of compassion and service. The landscape for where and when healthcare is provided is swiftly changing. Consumers expect care to be convenient, easy to access, resolve their issue with ease, and at an affordable price. Our industry is running at full speed to catch up with our consumers' demands. We're fortunate in the state of Colorado, a state that has moved forward, has forward-thinking leadership about improving health in our community. Over the past few years, the number of Colorado residents with healthcare coverage has grown to unprecedented levels. Those changes have created opportunity and challenges for our industry as we work to keep up with demands. As a state, we want to be the best place to live, and with that desire comes a tremendous workload in making sure that we're providing the right type of care when and where our patients need it. I want to share with you a little bit about my path of becoming CEO at San Luis Valley Health. Michael spoke to it just a bit. I graduated from college in the mid-1980s, and in order to truly date myself for a number of you in the crowd, with a degree in mathematics and computer science, I was one of the first classes of graduates who were trained using the personal computer. Go ahead and laugh, it's okay. Most everything prior to this time was a mainframe system, and it required a huge room, air conditioning to function, and most small businesses didn't have that opportunity. My first job out of college was to convert small businesses to personal computers for an accounting firm. One business at a time, I brought automation to an otherwise largely manual process in our industry. After a short stint at this, my husband, who was a professional runner at the time, received an offer to come to Alamosa, Colorado, where, as Michael said, running is big. And he was afforded the chance to train with a professional group sponsored by Reebok in anticipation of competing in the 1988 Olympics. We decided to make this move sight unseen. With no internet or Google Earth, we took a leap of faith and declared that we would take a risk. When I told my boss at the accounting firm that I was moving to Alamosa, Colorado, sight unseen, he promptly brought me an ad for a $99 divorce. He told me that, you're making a huge mistake and you've lost your mind to leave behind this promising career to move to somewhere that you've never seen, and that he would actually pay for the divorce if I wanted to do it. My husband and I said, we're going to do this, and I'm not sure why we're going to do it, but we're going to do it, and we can do anything for a couple of years. So we arrived in Alamosa, and I began to search for employment. I found a place in healthcare to apply my college education, and thus my career began. I worked implementing technology and then moved into clinic operations, later into a chief operating role, and along the way, I completed several fellowships, including one at the Anderson School of Business at UCLA. I truly started at an hourly role and worked my way to the C-suite in a small town. I tell you this story because healthcare careers can start in so many places. We have roles for caregivers, project managers, doctors, accountants, facility workers, dietary, leadership, lab, imaging, and many additional team players. You are looking for a job at a time when healthcare is going under tremendous change and tremendous opportunity. We can see a future of providing services outside the brick and mortar walls where so much care has been provided historically. We're feeling a pressure from our communities to be transparent, not only about our costs and our prices, but about our outcomes and our quality. I believe these are the right changes, the ones that will make us a better healthcare system. And frankly, we need you and others like you to make these changes come to fruition. Because regardless of all the changes we want to make, one thing is certain: we are a business of human capital. To be successful, we need strong and caring professionals to engage with our patients and their support systems to truly improve their health. The community places a tremendous amount of trust in us, those of us who've chosen healthcare, and we have an obligation to honor and deserve their investment. We need your education and your skills to reach our missions. I believe there are 3 factors that make up a successful relationship between a business and its workforce, and those are to be wanted, to be needed, and to be appreciated. In healthcare, you're wanted. This event today is a wonderful demonstration of the want in our industry. You will find today a wide variety of organizations offering employment partnerships. I refer to them as partnerships because I believe that this is the nature of a successful career. Finding the employer that matches your career objective. Is it urban? Is it rural? Is it downtown? Is it the mountains? Is it with children? Is it with the age? Is it in a specialty area such as orthopedics, or is it in the full spectrum of primary care? Is it direct caregiving, supporting services, leadership? You're going to find them all here today. Our want is statewide. If your interest is in downtown Denver, where the city excitement is on every corner, there are multiple employers who represent that today and want you on their team. However, if your interest is slightly different, we welcome you to consider a rural or a mountain community as a possibility. For example, being a nurse in a small hospital or maybe even a critical access hospital is different. On any given day, you could be in the emergency room, you could be doing pharmacy work, maybe respiratory, or you could be helping a patient and holding their hand in a hospice room. The breadth and variety of what you will do in your career is endless. For those of us who choose a rural career, and yes, many of us choose a rural career, the possibilities are endless, and it brings a lot of satisfaction to our work life. In healthcare, you are needed. Our organization and our industry is seeking employees who bring education and talent to our teams. Our patients and our communities are opening their arms to those who have chosen healthcare as a career. We have open positions all over our state waiting for the right person. We have teams that are ready to embrace a new generation of workers or workers who are just seeking a change or something that would invigorate your life. We're looking for talent that not only brings skill to the job, but they bring will to the job. Skill and will. These are the elements we're looking for in our workforce. Strive to be a leader regardless of the position you hold. Skill is about your education and your professional preparedness for the job. Will is about your desire to work hard, be dependable, engage in a team, and align with the mission in organizations. Those are the workers that we need. And finally, appreciation. That element of finding joy and purpose in your work. Appreciation in healthcare will come in many forms. It will come from the organization that hires you and the team of coworkers who will be at your side when you tackle tough situations. Appreciation will come from the patients and families as care is given. We don't make widgets in our industry. Instead, we make a difference in people's lives. I do not have the privilege of being a direct caregiver, but I always wanted to bring my skills in business and leadership to a job where collectively we're making our community better. That personal gratification comes from within you as you find meaning in the difference you'll make in your job. In my organization, we place a high priority on community service. As a team, we host community service events where we do things like install smoke detectors in elderly family members' homes. We do outreach, giving flu shots at the vulnerable homeless shelters. We have a baby shower for our community where supplies are obtained and are given to new moms throughout the whole year. One such recent event we held is called Lids for Kids, where we host all kinds of emergency responders, police, fire, ambulance, air ambulance, hospital workers, etc., in a park so that kids can get an up-close and personal connection to those who were there when an emergency will arise. We gave away nearly 200 bikes this year and last year, and we had over 1,000 children show up in our community park. These types of activities connect us to our work. They connect us to our community and our meaning as professionals. The feeling of making a difference is everywhere in healthcare. Allow yourself to open your eyes and your heart to embrace it. You are truly needed, wanted, and appreciated. I encourage you to explore this event today. Consider the possibilities. Take some risk. You too could potentially move to a new town, identify your passion, find a career path, and have a job that brings you joy and fulfillment. I thank you for considering these opportunities today, and I wish you the best of luck. I have a few minutes to take some questions. If anyone has any questions, and they can be as broad as rural and urban, leadership roles, anything that you'd like to hear from today. Thank you.
Well, we are, I think, the job seekers, if you're ready. We've got 35 employers there. And hopefully, as Connie mentioned, that this could take a risk, look at everything that's there, and we hope that you have a successful day speaking with the employers. Thank you.